Thank you, sir, for giving me this opportunity. So, as sir has already told about the topic, so I'll be talking about medico-legal cases and especially in emergency situations. So, in emergency situations, medico-legal issues primarily means MLCs, medico-legal cases. What kind of case is a MLC and what kind of case is not a MLC? That is one of the first things. So which case is a MLC case? MLC case means medico-legal case. So any case which requires any further investigation by any of the law enforcement agencies, whether it is police, whether it is executive magistrate or judicial magistrate, these three are usually the people who will be investigating any cases. So if they have to investigate any case any further, that case is to be labeled as MLC. Now, second question is, which we often come across, is who is going to tell us whether this case is a MLC case or not? So, audible now? Okay. So, whether a case is to be labeled as MLC case or not, whether police will tell or whether someone else will tell or not, it is entirely the doctor's prerogative. It is the doctor who has to decide whether to label a case as MLC or not. Where this practical thing comes in is, many times people come with injuries. And once they are told about any injury, or especially in government setups, I think most of the audience here is from private practice, but in government setup where the casualty is flooded with patients, very often what they will do is, if you don't want anything, you just tell something like that, or you write that I do not want a MLC. That is a very wrong practice that should not be practiced anywhere, that should not be done. It is for the doctor to see, examine the patient, consider the demeanor of the patient, and see whether if that injury belongs to some kind of criminal case or not. If he feels that it is likely that for some further investigation is required in this, it may involve police authorities, then he should go for labeling the case as a MLC. Making a MLC is not much of a problem. Not making the MLC is the biggest problem. And there are cases where people have landed in trouble. Of course, 2-3 scenarios or 2-3 cases that I know of. All the cases happened in government setup, that either they did not make the MLC or they did not preserve clothes, things like that. I'll talk about the relevant cases later. So now once we...
Sorry for the interruption. There is one Ciaz car parked, grey color. It happens to be a number with DL6C97458. It belongs to. So, Kotani. Sorry, sir.
So, now what all are the essential things once we decide that whether this case is to be MLC or not? So, identification is the first thing, that whether this case is to be identified as a MLC or not. Registration means for all medico-legal works, cross-reference is one of the very, very important things. In many states we have seen doctors, like in Haryana, where they at the peripheral centers, they are not maintaining registers. The doctors, it is their job entirely, keep a copy of the patient's record, and after 4 or 5 years when someone comes, many of them, they lose that paper and they find it really difficult. In any case, whatever setup all of us are running, whatever setup we are working in, it is our job that there should be a separate register so that it is not lost, at least. And why isolation? Just because of these legal formalities that have to be followed specifically for that particular patient as compared to any other patient for whom we will be providing any treatment. Now, the next biggest thing is notification to police. In bigger hospitals usually, and especially in government setups, there will be a police constable permanently posted there. The issue is regarding the smaller setups where they have not posted a person. So here what we should do is, if we have some liaison with the local police station, then it is okay, they will nominate some person. Otherwise, one of the best things is simply inform on 112 or 100 number, whatever you feel like. Nowadays 112 has become standard. Just call on there, such and such patient has arrived in my facility, and IO may kindly be sent. IO, investigating officer, some police person may be sent. They will come immediately. Now, place to place, they have different trends. He will come after every hour, every 2-3 hours to collect the last 4-5 cases, like that, depending on how much is the workload. But this notification is a must, and it should be recorded in our document. That is very, very important, that I have made a call with this number at this point of time. If you record this very important, and that is a legal binding thing that we have to inform the police, that is complied with once you have made a call. Then maintenance of the records and custody of the records, of course, that is important. All records, once it is labeled as MLC, every succeeding document is a MLC. Like any lab investigations, right up to death or discharge of the person, whatever treatment document is being prepared, that is to be specifically labeled as MLC. And in government setups, what we do is we usually prepare a red big stamp writing with MLC written over it, and all the pages will be stamped by the staff on duty, so that no page is getting mixed up. Now, in many cases, there is preservation of evidence, which is of very much relevance. So, what all evidence we have to preserve? Commonly, like suppose someone comes with a stab injury. If the person survives, you operate on him, he survives. If he goes back and the clothing is lost, now that is a big issue. That is considered as loss of evidence. It should not happen. Poisoning cases, if the person is vomiting there, then that becomes sample for that poisoning, which is known as gastric lavage. Whether you conduct the lavage or not, that is different. But usually, even in many setups, all they do is they just give some salt water, the person vomits out, ask them themselves to collect a part of it, and that is itself a gastric lavage sample. If you are writing vomiting in the case sheet or in the MLC document, then it has to be preserved. So, clothing and vomit sample, these are very common things which can be, things which will be lost then and there. That once it is gone, it is gone. Things which can be collected later on, that doesn't amount to that much of an offense. This cloth issue, most of you would be knowing, in I think Hindurao hospital, one female doctor was found unconscious in the hostel, and they brought her to the casualty. They thought this, that, and since she is internal, their own hospital issue, they tried to hush up the issue, and the MLC was not made then and there. Later on, after 2-3 days, she died. By the time the clothing had been changed by the staff, she was in ICU, the original clothing was gone. And once the police got the intimation, they wanted the clothing for the patient. Both the duty doctors, they got named in the FIR for loss of evidence, and they have been facing trial since then. So, such things we have to be very careful for. Loss of evidence should not occur. Now, as far as dying declaration is concerned, this all of us must have read in forensic medicine. All that we need to write is whatever the patient is saying. We must not interpret it in our own language. If you cannot understand it, if suppose it is in some other language, try to get someone who can get it. Otherwise, nowadays it is much more easier. You can just record it on mobile, whatever they are saying, get it interpreted by someone, and then note it. It should be in the language of the patient. Whatever the person has spoken, that is to be mentioned. If the person survives, then that becomes nullified, but if he doesn't survive, then whatever he or she has said, that is very much relevant. Now, what sort of cases commonly are to be considered as MLC cases? First of all is broad dead. If someone brings, and in broad dead also, first is we must check thoroughly. We should not try to send them away. or say that he is dead, we should check thoroughly. And second thing, nowadays with so much of CCTV coverage and everything available, in government setups also there is a trend that they will tell ki, why to make a MLC, you take him away, take her away. But that is, I would say, a very wrong practice. Once in a while issues come up that they will say we went to this hospital, they refused, they did not prepare any document, they sent us away. Now we have come here. Now if something goes wrong, if everything goes okay, then it is of course a non-issue. Every day so many things are happening. But if something goes wrong, then they say I went there, and you will say no, he did not come here, that's why I did not make any MLC. Especially cases where murder is involved. And later on when the person is caught, then people get into soup. Otherwise it is a non-issue. So either we prepare some documentation based on history, whether you want to make a MLC or not, that is your prerogative. But they should not be sent away that so that we don't have to make a MLC and we want to send you back. That should not be the thought and the practice. Same is the thing with unconscious persons also, whether it is brought dead or whether it is unconscious and no clear history is available as to what has happened. It can be poisonings or it can be some hidden injury, anything like that. As far as injury cases are concerned, if they say that I have been assaulted, or even if they have met with an accident. Now, as such, legally binding are heinous offences. They have described in those sections as to what all cases information to police is mandatory. But why we have to make MLC is, suppose that person has met with an accident. We don't make an MLC. Later on what happens is, you will be taught by some advocates, you should have made an MLC, you should go to court, claim this compensation, fix up that car fellow, and get this much, get that much. So with all that involvement, then unnecessarily, at least we have to cut a sorry figure in court. They will say, why didn't you make an MLC? You are such a senior doctor, you don't know this, you don't know that. That is the thing. So any kind of, if trauma patients come, if we are convinced that suppose somebody has simply fallen in their home, it's non-issue. If children playing among themselves got some small time injury, that is a non-issue. Any vehicular accidents, any industrial accidents are even worse as compared to vehicular accidents. Vehicular accidents, it's a small issue. Industrial accidents, they always want to prosecute the industrialist or the owner or manager of the institution, whatever injury occurs, so that should never be left out. Burns, once again, small to large, depending upon, we don't know after 30-40% burns when the person may die. Despite the best of treatment, people die. So one is that they are very much liable to die, and second thing is, very often, especially in females, there is going to be allegation whatsoever may have happened, but the bride side, they will say that these fellows, they poured kerosene over her and burnt her. So any kind of burns, it should always be taken up as MLC. As far as alcoholics or poisonings are concerned, alcoholics usually they will end up in government setups only for medical examination when brought by police. So otherwise, the poisonings, they usually fall in unconscious cases, or rarely they may be conscious, they may tell. And the common poisonings that we see here are aluminum phosphide. Usually survival is very little, so it is best, even if they are talking and everything is okay, it is best to make an MLC. Survival is very rare. Then sexual offenses, of course, it's very, very sensitive issue. And in these issues, we should not be considering place also. Look, even if somebody says ki sexual assault has taken place in so and so state, 300 kilometers away from here, we should not say that you go there and call the police there or do this, do that. They have come to us. Our job is to make a record of whatever findings we see, inform police, close the book, that's all. Attempted suicide, once again, if we see, I'll be showing photographs what cases look like. But people with especially marks on the neck or poisonings, then they may be attempted suicide also. And if that is there, then once again that also falls into that category only. Now, those cases where death is caused by some animals, snake bites, all of us must be remembering the forensic question, especially of sui, the Abrus precatorius. So, because it mimics snake bite. Then there are cases nowadays, many times you read in newspapers, the person's dog has bitten me very badly. So they may claim that this fellow asked the dog to pounce upon me and bite me. So that is why it becomes relevant here. We have to make an MLC in case of death or injury by animals also. And last but not the least, those persons who are arrested, they also have to get medically examined, and for them even no consent is required, and if he is a rape accused, then he can be, force also can be used to examine him and collect evidence. But that is mostly limited to government setups, not in private areas. So overall, if we see what is MLC, it is just good record keeping. I will be telling about what all is to be mentioned in that. So what all are the components of it? Some of the very, very important and relevant things are, it is to be made by the doctor who is first coming to know about the patient. Like for example, most of the cases they land up at the emergency, MLC is made, it's okay. Sometimes they will not tell anything at the emergency. The patient has been admitted for 2 days, later on some finding comes up. Suppose there is a gynec referral and they find out that there is some injury, prepubertal child or maybe a minor child. Those cases, or there are cases many times person came without any clear history, not able to, though semi-conscious but not telling very clearly what happened. After 2 days someone tells that this and that has happened. It is not a delayed MLC. The moment the doctor came to know this is the thing, you prepare a MLC. Those working in a larger setup also, sometimes disputes arise in our hospital also. People in the ward, they will say, why we are going to do it, casualty people. You have come to know that so and so thing is to be labeled as MLC. So you go there, use that register and just prepare it. That's all, if there is a centralized register. If that is not the scenario, then whoever doctor, those who are running single clinics, they themselves just prepare it. Now patient has told so and so. Patient is admitted for 2 days. Now we give so and so history. So in my view, it should be a MLC case. Then you can prepare. And it is best whosoever has seen the injuries, the findings before any intervention. Because once medical intervention is there, a lot of things will change. So what all are the essential components of the MLC? Whatever format you make, there are certain things which should be enshrined in that. So introductory data means introductory, the patient identification information. Whether we know the name, whatever information we can get, that is to be kept. Then in this, there used to be identification. Of course, name we can write, but suppose unconscious patient, you would be knowing, there is nobody to tell the name. Then how to identify? The earlier trend was writing 2 marks of identification, a black mole here, a scar there. Nowadays, the best thing is take thumbprints and take both thumbprints. Don't go for right for male, left for female or vice versa. Just apply stamp pad on both the thumbs, just put them on the paper and mark them LTI, RTI. That will do the job. That will finish off the work of identification of the person. If the person is living and if they come with injury and you have to take thumbprints, there we have to be cautious about 2 things. Those thumbprints have to be discernible. They should be clear. Now in thumbprints, fingerprints, what we have to examine is minutiae. Minutiae means like gaps, bridges, dots, these are the things. Bridging, branching, these are the things. Very commonly, if you tell someone to put thumbprints here, they will first stand with their thumbs on the stamp pad and then stand with their thumbs on the paper also, smudging everything and nothing is visible. Or otherwise, sometimes it will be put so lightly that the cloth covering over the stamp pad, that itself, that pattern will be seen rather than the fingerprint. we should be careful that the fingerprint should be seen. It should not be so badly inked that it is smudged totally, and it should not be so light that some different pattern is being seen. It should be identifiable. Once thumbprints are taken, all dispute about identity is finished. Many times it happens in courts, they say that आपने तो डॉक्टर साहब इस आदमी को तो एग्जामिन ही नहीं किया था. We are simply, we have one defense. I examined the person whose thumbprints are here. Whether his name is XYZ or ABC, it is not my domain. All right, so we take both the thumbprints. Then consent, of course, whatever examination you are doing, consent is to be taken, except for those who are arrested by police or brought by police for medical examination, that is exempt. Rest all cases, consent has to be taken. And it has to be written consent that my examination and findings may go against me also, and it has been explained by the doctor to me in their own language. You all know about consent much better. Then history. Now, history of the case, in many cases I have seen the doctor writing so much of history, especially in sexual assault cases. Nowadays, so many cases come where everything is consensual beforehand, and thereafter, after 2 years, 3 years, they lodge a complaint. They will write everything. We went to Kashmir, to Kanyakumari, everything is written. The examination part is just one line, NAD, finished, full stop, nothing else is written. Now that is a very bad thing. History, what we are supposed to write? We are supposed to write the history considering the examination that we are going to make. We are seeing any injuries, how that injury could have been sustained. So classical mistakes are, he was attacked by ABC and XYZ and this, that, these 5 people. Ji, Doctor Sahab, naam likho inka sabka. We are not, whether A hits or B hits, we are not concerned with that. What we are concerned with is injury has occurred, किस चीज से मारा भाई, चाकू से मार दिया, डंडे से मार दिया, गोली मार दी, क्या हुआ जो तुमको मालूम है वो बता दो. So what kind of assault has taken place, what kind of weapon has been used, or if it has been an accident, whether a vehicular accidents like he was crossing the road, hit by a 2-wheeler, that is sufficient. Or hit by a 4-wheeler, riding a 4-wheeler, riding a 2-wheeler, wearing helmet, not wearing. These are the few questions which are of relevance in case of history of the person. Whatever examination findings will be affected by that history. The persons, 1 person, 2 persons, 5 persons, all that is immaterial. घर के नीचे खड़ा था जी, वो ऊपर आ गया. Actually, they are also in a very agitated state of mind. So they tend to tell so many irrelevant things also. And it is not only irrelevant for us, it can be derogatory many times. What happens is, you record something, some names of persons, something else. Once the case goes to the court, by the time either he will become hostile or some other version will come up when police investigates, and there will be a dispute between the doctor's statement and the statement which is being given later by other people. So we are supposed to write the history as far as it concerns the examination findings, that's all. Then observations. In observations, since we have to be primarily focused about the type of injuries, so the type of injuries is very, very important. The common things like abrasion, contusion, laceration, and incised wounds, whether incised or lacerated, whether it is stab or not, firearm injuries, burns. These categories of injuries, they should be specifically and clearly mentioned. And let me tell you, I am not exaggerating. I have seen MLCs, a case of burns came, and the doctor had written in a big government setup, large lacerations present all over the body. That was a description of burns. So such cases, they mislead, and they will unnecessarily waste the resources of police, waste the resources of court, and once people get hold of such things, they will unnecessarily lodge cases, things like that happen. So injury description should be, though it may not be exact, in casualty places, we cannot describe or measure with scale every injury. That can be done during postmortem, but of course not during casualty. What we can do is, commonly, all of us, whosoever is dealing with the emergency cases, you can just measure your own hand. How much is the width of my one finger? How much is the length of my finger? Two fingers is how much? 2-3 dimensions you can assess. That becomes a very quick way of assessing small injuries and writing like it is this much, 1 centimeter long. Whether it is 1 or 1.3, it won't matter that much. But 1 should not become 5 centimeters, or 5 should become 1, that should not be there. If it is approximately okay, 10-20% off is all right. So the dimension of the injury and the type of the injury, and especially things like injuries, physical injuries or mechanical injuries, these 4-5 types, the names that I have mentioned, these are injuries. Simply a swelling, the person may be having a lipoma, a neurofibroma, it should be seen whether it is an injury or not. So then only it should be mentioned. Simply writing swelling is because the next question immediately in court is swelling. तो डॉक्टर साहब वहाँ ऐसी भी होती है, किताब लेके आते हैं, किताब से दिखा देंगे वहाँ पर कि ऐसे लाइपोमा होता है, आपने देखा वहाँ पर रेडनेस थी नहीं थी, पेन था नहीं था, फ्रैक्चर था नहीं था, आपने तो सिर्फ स्वेलिंग लिख दिया. स्वेलिंग तो कुछ और भी चीज़ से हो सकती है. ओनली स्वेलिंग नेक, दे आस्क द स्पेसिफिक क्वेश्चन, स्वेलिंग है तो ये तो किसी भी चीज़ से हो सकती है, इन चीज़ से भी हो सकती है. दे विल हैव टू से यस. If other things are not mentioned, then that case fizzles out. Once it can be caused due to some natural disease, the person is fabricating and it's done. So thereafter, if any treatment, advice, referrals, whatever is being provided, treatments and all usually doesn't land up as such in the medico-legal issues relating to the patient. It may lead to medico-legal issues later as far as negligence is concerned, so whether treatment is appropriate or not, but not with that MLC. That is to be considered in each and every case, whatever we are doing, so that we avoid negligence complaints and all. Then whatever evidence is being preserved, as I told, clothing, if any blood stains are present, if any seminal stains, salivary stains, all that detailed examination, whatever is to be done, that is to be done. And whatever opinion you want to form based on examination of the person, based on the investigations regarding the injuries, whatever we have seen. Whether they are simple, they are grievous injuries, they are dangerous injuries, dangerous to life or not, like that. And in the end, the doctor has to sign and write his or her own name also. In this introductory data, if police brings, then of course police will provide some number. If, as I told earlier, when we are informing police, we have to write that detail, even if you do not get a specific number from them, because local police station will give some number. But if you call on 112, you simply write, I informed with this, my phone number, this, and at this date and time. That will do the job of informing the police, because that record is permanent, it can be traced for up to 2 years, so no issues. And another very important thing, now we have prepared this report, whether we give it to the patient or keep it with us or give it to police. All three actually need it. Police needs it for pursuing it further. We need it once we are called in the court. If you don't have a copy, then what will we say? So we have to also keep a copy. And rather than preparing a separate sheet for the patient, it is best that you give a same copy to the patient also. In police cases where police gets the medical examination done, it is mandatory to give a copy to the person who has been examined. So we make it either in duplicate or in triplicate. And as I said, all records are to be marked as MLC, and if it is case of death, whether it is brought dead or whether the person dies after treatment, we have to not hand over the body to the relatives, we have to give it to police. Now quickly I will just show some formats. This is the format that we follow in our institution, and these are MCD forms. I think all of you where death has occurs, you would be knowing. Now I'll show, just for a quick recap, I'll show some photographs and all, abrasions and all. I think we will just rush through this. Stab injuries, different kind of, let's, actually here the time is only half an hour, but usually because all this helps to assess what kind of cases we get. All this I have already told actually. Mark all records. So any questions are welcome. Yes, sir.
Regarding dying declaration,
Sir.
you said it can be recorded on mobile. Now, how will you prove in the court of law that this declaration belongs to this particular person?
This?
This record which you have got belongs to that particular person.
Sir, yes, sir. Sir, actually, once you make it, the person is, obviously police is getting involved. All you have to do is you have to give them a copy of that recording that I made this. नहीं सर वो एक मिनट सर, मैं बता रहा हूँ सर ये दो अलग अलग नाम है, एक होता है डाइंग डिक्लेरेशन, एक होता है डाइंग डिपोजिशन। वो जो डिपोजिशन वाला होता है वो होता है कि एसडीएम को बुलाना है। डिक्लेरेशन इज सिंपली पेशेंट ने मरते, उसको आभास हो रहा है कि ही इज अबाउट टू डाई, एंड दैट मोमेंट वट एवर ही सेज, सपोज उसको गोली मार दी किसी ने, उसको लग रहा है कि यार मैं आई एम सिंकिंग, ही वांट्स टू से समथिंग, तो यू जस्ट रिकॉर्ड इट। वंस द पुलिस इज इन्वॉल्व यू जस्ट टेल देम कि जी इसने मरते मरते ये बोला था। मैं बता रहा हूँ सर, हाँ जी सर, मैं बता रहा हूँ सर वो हमारा काम नहीं। आपने पुलिस को दे दी ना कॉपी, ऑल यू हैव टू डू इज उसको एक 65B का सर्टिफिकेट होता है, वो एक पेपर पे आपको लिख के देना है कि ये मेरे फ़ोन से रिकॉर्ड हुआ था, इसमें कोई छेड़छाड़ नहीं करी गई, ये दिस इज़ द ओरिजिनल रिकॉर्डिंग। वो पुलिस का काम है सर, वो लिखेगा, वो उसका काम है सीज करना कि मैंने डॉक्टर साहब से ये लिया है। हाँ नहीं फ़ोन वो ठीक है, वो सर वो आप कह सकते हो, आप दे दो पेन ड्राइव में, दैट इज़ फुल्ली एक्सेप्टेबल। 65B का एक सर्टिफिकेट होता है, विद दैट सर्टिफिकेट मीन्स इट इज जस्ट ए पेपर डॉक्यूमेंट कि इसके साथ कोई एडिटिंग नहीं हुई है, कोई छेड़छाड़ नहीं हुई है, दैट्स ऑल। सर सर वही तो मैं बता रहा था, लोग ऐसा बोलते हैं ना सर कि कुत्ते से कटवा दिया, तो हम कैसे उसको अवॉइड करेंगे। वो बोलेंगे जी कटवा दिया, डॉक्टर के पास गए, उसने देखो कागज भी नहीं, रिकॉर्ड भी नहीं बनाया हमारा, वो डॉक्टर भी उसके साथ ही मिला हुआ है। इमीडिएटली सर मेडिको लीगल केसेस में तो तुरंत डॉक्टर या तो पेशेंट की तरफ है या अपोजिट पार्टी की तरफ है। सर जी सर, जी सर, सर स्ट्रे डॉग छोटा मोटा काट लेता है वो अलग बात है सर, पेट डॉग और जिनमें डेथ हो जाएगी उनके अंदर इशू है सर। स्ट्रे डॉग तो छोटा मोटा, ज़्यादा बाइट हो जाए तो बना दो सर, अगर इतना ज़्यादा बाइट कर लिया, कुत्ते ने काटा उसने बोला है सर, वो पुलिस जाने सर, इन्वेस्टिगेशन का काम पुलिस का है सर, हमारा नहीं है। छोटा मोटा मैडम बाइट होती है ना, दैट इज सी वही तो है ना, दैट इज आवर प्रेरोगेटिव, छोटा सा बाइट मार दिया इट इज नॉट ए इशू। लेकिन एक बात है मैडम, जो बात बोल रहे हो, अगर मान लो यहाँ पर दिन में 200 ml स्ट्रे डॉग की बनने लग गई ना, तो थोड़े ही दिन में स्ट्रे डॉग बंद हो जाएंगे। दैट इज देयर। ऑल राइट सर, थैंक यू वेरी मच।